I write books about food politics. And when the coronavirus hit, I could see right away that it was a food systems issue. And I want to talk a little bit about the relationship of food systems, the coronavirus, and public health in the United States. It's been an interesting year. I think that's an understatement. I guess the most dramatic part about it is the milestone of 500,000 deaths from COVID-19, but also that in the context of a recent trend in the last 20 years of a leveling off of life expectancy, first because of the opioid epidemic, and now because of COVID-19. Um, this is a food system issue. And the reason that it's a food system issue, and I should say that food systems are the new buzzword that everybody's using to talk about ways of looking at everything that happens to a food from the time it's grown, processed, distributed, purchased, eaten, and wasted, the entire system, and using a systems perspective to look at these kinds of issues forces you to link agricultural production to food, to nutrition, to public health, and the environment, so that all of these are inextricably linked. And it's not possible to talk about one of them without talking about all of them at once. And we see this with the COVID pandemic. The COVID pandemic is a food system issue because it revealed the importance of diet to health, the inequities in public health that have led to so many problems in the supply chains, the unusual and otherwise invisible plight of low-wage workers in our society, the power of corporations in the middle of all of this, the politics of hunger, and the need for advocacy and an agenda for advocacy. The most obvious was the effect of diet on the chronic diseases that had led to poor outcomes from COVID-19. The greatest risk factors and the people who were at highest risk were those who were overweight and at greater risk for high blood pressure, type 2 diabetes, and cardiovascular disease, clearly related to diet. And we saw this in a recent study that found that 78% of people hospitalized for COVID were overweight or obese. Obesity is very closely linked to socioeconomic factors in American society. Obesity prevalence is higher among Black and Latino adults, and corona cases are higher among Black and Latino adults. Not a coincidence. Obesity is greater in minority populations, and the cases and the bad outcomes are higher. But this is not because there is anything intrinsically risky about being Black or Hispanic or Latino. The problems are socioeconomic. The same social and behavioral determinants of health, racial and ethnic discrimination, lack of access to healthy food or health care, the kinds of neighborhoods that people live in, their socioeconomic and educational status, and the entire social and community context in which they live are all factors that predispose, on the one hand, to obesity, on the other to chronic diseases, diabetes, hypertension, cardiovascular disease, and pulmonary disease, and also to severe outcomes from COVID-19. So these are system issues in which it's very hard to tease out the role of one or another risk factor because they're all related.